Why do I lick pee? Hello everyone, welcome to another episode with me. My name is Pisti Kolawole, a healthcare consultant, and I specialize in patient experience and education. So today we'll be treating a frequently asked question. And one of those questions I have on my list is, why do I lick pee frequently? Like, I might just laugh and then I just feel a drop of urine, or maybe I just sneeze and then I feel a drop of urine. Yeah, this is a very common condition, and it's not really a condition or a kind of disease or a kind of ailment, so don't be scared. Yeah, let's dive down. So this condition whereby you leak urine during some physical exercise or during some activity is known as stress urinary incontinence, and this is as a result of you lacking the control over your bladder, because the bladder is that place where is that storehouse for urine. And so when you lose control, maybe as a result of a weakened muscles around the bladder, it could lead to urinary incontinence, and this is a very common condition. We have a temporary condition and we have a chronic condition. In this sense, the temporary condition is this example of stress incontinence, whereby you leak pee maybe because you just sneezed a little, or you laughed a little, or maybe during exercise. This can be corrected by some kind of bladder training, or you reducing those physical activities, or if there is a kind of examination around your bladder and there could be some underlying conditions that causes that could be treated, or a surgery could be performed. But in these instances of stress incontinence, it is rare for you to undergo surgical procedures because of this is just due to stress. Muscle that is responsible for the control of the bladder, which is the sphincter muscle, it is weak. And when you now come to the chronic urinary incontinence, or a kind of incontinence whereby it becomes a thing of worries when you leak pee too often, it's regular. This chronic incontinence usually occurs as a result of aging. As we age, our muscles, our tissues, our systems, they tend to age alongside with us, and their work functions tend to reduce as we age. So these muscles might get so weak, it could not lead to leak of urine at the long run. And then after aging, another factor that could contribute to urinary incontinence is urinary tract infections. Yes, infections also causes urinary incontinence, in the sense that it irritates the bladder because there is a kind of inflammation around those areas, or there is a kind of invasion of bacteria around those areas. It irritates the bladder and causes a kind of swelling around the bladder, whereby it causes the muscles around the bladder to get weakened, and then it now causes a leak of urine, which could be temporary incontinence if necessary measures is taken by managing the infections. And then another cause of urinary incontinence is enlarged prostate in male. When there is an enlarged prostate, because the prostate glands, or the prostate glands, yes, the prostate glands is located closer to the bladder in men, and when there is enlarged, it tends on pressing on the bladder, causing the bladder to release or to leak urine involuntarily, and this could cause a urinary incontinence. Then another cause could be damage to the pelvic floor, and this is very common in women. Especially those women who have gone through the childbearing procedure, because during childbearing procedure there could be a damage to the pelvic floor, and this could now cause urinary incontinence in some of them if appropriate measure is not taken at that point in time. So it is very, very important to take note of this during childbirth, that if there is a kind of exertion during the labor process in childbirth, it could damage the pelvic floor and could lead to urinary incontinence. And then another cause of urinary incontinence is kidney stones or bladder stones. This could be as a result of your lifestyle. Maybe you don't drink a lot of water, and then there's accumulation of minerals which forms kidney stones in the bladder, and which could lead to involuntary leak of urine from the bladder and could lead to urinary incontinence. And lastly, another cause could be lifestyle. Yes, lifestyle, in the sense that if you drink too much, smoke too much, consume a lot of caffeinated drinks, consume a lot of alcohol, you tend to have a urinary incontinence, in the sense that you are exerting so much pressure on your bladder as a result of your body system trying to process those things you're taking, the drinks, the alcohol, the caffeinated drinks especially, it tends to process it a lot and exert so much pressure on the kidney, and this also releases a lot of urine to the bladder, of which the bladder gets so weak to be able to contain that amount of urine at that particular time, and then such individual tend to leak urine. And this could actually be a temporary incontinence if there was being controlled and limited at that point in time. So urinary incontinence could be temporary and it could be chronic. It could be temporary in the sense that it could be traced to some lifestyles, and these lifestyles are being controlled. Then, like, your healthcare provider could put you on some bladder training, could give you some kind of medications, and then you're fine. But it could become chronic, whereby you have some underlying conditions like an enlarged prostate or a damaged pelvic floor, or as a result of aging. So the only thing that your healthcare professional could do is to manage it appropriately for you, or probably might ask that you undergo a surgical procedure for them to operate on the prostate, repair the pelvic floor and all of that, and then your body system is back to normal. So that is all for urinary incontinence. I hope you were able to learn one or two from today's episode. Please don't forget to like, share, and make your comment. If you have any other questions concerning this topic or another, please drop it in the comment section. I'll be waiting to receive them. Thank you. Bye.